Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. Today the topic is what you need to know about facet injections. Well, what exactly is a facet joint? It's spelled F-A-C-E-T. These are small, thumbnail-sized joints located on either side of the spine at every level, all the way from the neck down to the sacrum. They are cartilaginous joints, just like the hip or the knee, and they combine to produce an incredible range of motion of one's spine. Unfortunately, these joints are subject to arthritis just like any other cartilaginous joints. Even though they are small, about the size of a thumbnail, they can produce incredible amounts of pain. Typically, pain develops in the area of where the arthritis is. If it's in the low back, you might have pain that radiates out into the buttock area and the flank. And typically, a patient will have arthritis in multiple joints at one time. It's very unusual to see it isolated to one joint. So here's an example of arthritic facet joints. Here's the back of the spine, the spinous processes you can feel on your back. These are the facet joints. Here, this one looks really good actually. Then you have one that has bony, extra bone formation, bone spurs. You can see that it's actually growing forward as well, pinching on these and inflaming these nerve roots as they come out. Both these levels are arthritic. What it causes is bony overgrowth. The spine produces the extra bone to try and stabilize these arthritic joints. You don't want that, or you don't need it, but that's what the body is good at. It's not when it becomes not so great at producing cartilage anymore, it produces bone. Why are the facet joint injections performed? Well, for symptomatic facet arthritis, there really is not a great surgical answer. We don't have a facet replacement like we do knee or hip replacement. If you have arthritis at multiple levels, doing a spinal fusion is not a great idea because you're immobilizing certain areas of the spine. The non-operative options are excellent, and facet joints fall right into that. Similar to other joints with arthritis, facet joints do respond well to steroid injections. So it's an outpatient procedure. It only takes about 20 minutes or so. Modern pain management doctors will use fluoroscopy, which is a real-time x-ray. Patient will lay flat down on the table and on a table that has x-rays that are allowed to go through it. It's a radiolucent table. The skin is numbed and the soft tissues are numbed down towards the area around the facet joint. Then the needle is placed into the joint, and then the pain doctor will usually inject a little dye to make sure they've gotten into the joint okay, and then they'll inject the numbing medicine and the steroid. Several levels can be treated at the same time, and then the procedure can be repeated into that joint every few months. Well, how well do they work? There have been multiple studies looking at this. 82% of patients receive pain relief over 50%, and significant functional improvement was also seen in 78%. And that's with or without steroid. It's actually not clear whether or not steroid medication is necessary. Most doctors will do it, but the studies didn't show that was statistically necessary. The average duration of pain relief is 15 weeks, 3 to 4 months. And that was in 2 separate studies, large studies, 2007, 2008. The procedure truly is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. What happens if the pain comes back? Well, there are 3 treatment options if the pain returns. One is to simply do a repeat of the facet injection. It worked well the first time, should work well the second time. You can also perform a medial branch block, which is doing the same procedure, but the needle doesn't go into the facet joint. It actually goes into these areas around the joint and injects numbing medicine and steroid, and it blocks these tiny little nerve endings that supply sensation to the joint, and that can also produce 3 to 4 months of pain relief. Now, one longer acting procedure is called a radiofrequency ablation. Here you see a catheter coming in. Once it gets positioned, it actually gets heated up, and these little nerve endings around the joint are deadened, and that can provide pain relief for 6 to 18 months. So it's a much longer term procedure, and it's also done as an outpatient. Are there risks with facet injections? They're very, very low. You have a very slight risk of infection, bleeding, maybe an allergic reaction. The needle does not go into the epidural space, so you're not around the spinal cord, you're not near nerve roots, so there really is a negligible risk of any nerve root injury. The top pain management clinics in the Las Vegas area are Nevada Pain. They have a one-stop shop with pain management doctors, chiropractors, acupuncture, spinal decompression therapy, which can also be very good for facet arthritis. Over 50 insurances are accepted. The pain management doctors are all board certified. They've won the Patient's Choice Award 5 years in a row. So call today for scheduling at 702-323-0553 and visit us on the web at painmanagementlasvegas.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.